The Israeli occupation forces have turned hospitals in the Gaza Strip into graveyards, into scenes of death, devastation, and despair. Hospitals are constantly being bombed. Only 13 out of 38 hospitals functioning. And we see patients on the floors of the corridors. And on top of that, those hospitals are overcrowded with refugees who wanted to seek shelter, who wanted to flee the destruction and the horror into what they thought could be a safe place for them, a safe shelter for them. But unfortunately, the occupation powers keep attacking those hospitals, keep violating humanitarian law. And we've heard my uncle, who's currently the head of orthopedic department in Al Shifa Hospital, describing the situation where they had to amputate the 4 limbs of a child with very minimal anesthesia. And the reporter asked him, "How did you feel?" And he was like, "I'm a human being after all. What do I want to do? I have to do this." And I was performing the surgery, I was performing the operation, the procedure, while crying. The healthcare system has already collapsed. It has declared its collapse, but the attacks and the aggressions on the healthcare facilities in the Gaza Strip continue. My name is Mohammed Seyam. I am a medical doctor from Gaza, Palestine, who's pursuing a master's in global healthcare management here in London. I've lived my whole life in Gaza City, and the Gaza Strip is known for being under a constraining blockade for the past 17 years. I remember when I was only 9 years old, I was playing in this field next to my house, and that building got bombed. And I think it was my first ever exposure to the actual trauma of, number one, death. Number two, my family who got directly affected by what happened. I got my youngest brother who was severely injured. My father was injured. My mother was injured. My grandmother who was in our house was injured. And the fear itself after hearing this bombing and the whole scene turns black, you run for your life not knowing what's going to happen, is actually, again, is a trauma. You always say children in the Gaza Strip don't have PTSDs. It's not a post-traumatic event, it's an ongoing trauma to every child, even when they grow up, that sticks to their hearts, to their minds, to the point where they would never be able to live the normal life that we want our children to have. Even if there's, let's say, a peace or a truce for a couple of years, you know for a fact that in a couple of months or maybe weeks or days, there might be something that ends everything that you dream of. I'm kind of that positive person who always focuses on the positivity of things, but it is kind of terrifying to know that, oh, if you cross the certain line, whether that's on land, on the eastern borders of Gaza, or on the sea, on the western side of Gaza, you could just get shot. Hearing the drones in the skies of Gaza is terrifying. And sometimes when you try to go to sleep at night, you listen to those drones and it kind of haunts you. Sometimes it can just get nightmares. It haunts you even in your dreams. This sound for the Palestinians in Gaza means terror. It means that they're always horrified and afraid of the outcomes that might be followed by hearing this sound. It adds up to the fact that Gaza is under siege, that Gaza is an open-air prison, that everyone in Gaza should be monitored in order for the apartheid system in Israel to keep functioning. Every Palestinian, same as any other human being across the world, have full right to access healthcare. And in Palestine, when it comes to healthcare, there are duty bearers whom are obligated by international law to support the lives of Palestinians. On top of the list comes Israel itself as the occupying power, then the Palestinian Authority, the government in Gaza, and the international community. And Israel is not even respecting the sanctity of healthcare facilities. No medical system in the entire world has experienced this number of mass casualties, of tens of thousands of injuries and deaths. No healthcare system in the entire world is being denied the basic humanitarian supplies such as water, electricity, fuel. The WHO has reported 335 attacks on healthcare facilities in Palestine since October the 7th. And since that date, 124 healthcare facilities in the Gaza Strip have been targeted, including 25 hospitals that are now non-operational. And on top of all those atrocities, we keep seeing the attacks on healthcare personnel and healthcare staff, where Israel is trying to take the lives of the brightest and best minds all around the Gaza Strip, targeting almost 90 medical personnel. And the latest were their target on Al-Auda hospital in the north of Gaza, where 3 doctors, whom are MSF workers as well, killed because of the bombing. This system is now officially collapsed, as the spokesman of the Ministry of Health has declared, due to the attacks, due to the lack of resources such as fuel, clean water, medicines, the shortage of staff and medical equipment. We see women with postpartum bleeding whom are forced to get surgical removal of their womb because the doctors or the medical healthcare services do not have a blood control management equipment for the moment. We see asthma patients with severe attacks following inhalation of dust and smoke, children and other people whom are injured with burns, with fractures, wounds that we see worms coming out of, patients who could wait up to 2 weeks to get the surgeries that they need. And even if they get those surgeries would be run without anesthesia or sometimes with very minimal local anesthesia. Imagine yourself going into this amount of pain after the pain that you got through when your house was bombed. And then when you go to the hospital that was supposed to be a safe place for you, you go through a lot of pain to the point where people could actually die because of the pain that they go through. We see people dying even if they require sometimes very minimal medical support. With over 50 ambulances being directly targeted, it is even harder for patients to get to the hospitals. It is even harder for the emergency services to reach patients whom are in dire need of those services. Israel has targeted the only cancer center in Gaza and the only pediatric cancer unit in Gaza, emergencies, non-communicable diseases, public health services, every sort and every aspect of the healthcare system in the Gaza Strip right now is collapsed. Intense overcrowding and disrupted health, water, and sanitation systems pose an added danger. The rapid spread of infectious diseases, lack of fuel, has led to the shutting down of desalination plants, significantly increasing the risk of bacterial infections spreading among people who consume contaminated waters and shelters. Lack of fuel has also disrupted all solid waste collection. According to WHO reports, since mid-October, over 33,000 cases of diarrhea has erupted among those who are internally displaced, and half of which are among children under the age of 5. We're also seeing around 10,000 cases of scabies, 12,000 cases of skin rash, and around 55,000 cases of upper respiratory tract infections. Patients living with diabetes, hypertension, cancer, kidney failure patients who need dialysis are unable to get the very basic needs of medical treatment and medical support that they require. Around 80% of the dialysis units in the Gaza Strip are northern of the Gaza Valley, in Al-Shifa and the Indonesian hospital. And unfortunately, the remaining 20% of the south are now delivering the services to all Palestinians living with kidney failure who need dialysis. And on top of that, there is no clean water to support this process in the hospitals. Many of my peers with diabetes in the Gaza Strip have told me that they are unable to check their blood glucose levels for days because they don't have enough test strips. A lot of them have told me as well they are currently rationing their insulin and switching to other types of insulin, which makes it even harder for them to manage their conditions. When it comes to the Gaza Strip itself, there are a lot of extra challenges, such as the ongoing siege that limits everything going into and outside of the Gaza Strip, the occupation itself, from restriction of movement to restriction of types of medicines to restriction of services, the inability of, for example, services or devices to enter, the permit regime that forbids some Palestinians to go to their medical referral, to go to the healthcare facilities that they could get their treatment from. And I remember reading in a report of the WHO that in 2021, Israel denied some repair devices and repair parts of X-ray and CT machines to enter the Gaza Strip. 37.5% of the Palestinian Ministry of Health expenditure goes to medical referrals. And that's because the services that are provided in the Palestinian hospitals, that especially, for example, in the Gaza Strip and other parts of the West Bank are restricted because of the lack of resources, the untrained medical staff, the inability actually to train those medical staff to get hired, for example, subspecialties in order to serve those patients. So around 26% of medical referrals are referrals for cancer patients, and cancer patients need, and most of the time, urgent medical treatment. That could be radiotherapy, that could be chemotherapy, or sometimes maybe surgeries to support those patients. But you need Israel's approval, and the whole process could take up to months sometimes. And only 65% of Palestinians in the Gaza Strip get approved of their permits when it comes to the medical referrals. And when we talk about children, around 32% of them can get their approval, but without a chaperone. The only way for that mother to let her child live is to send her child with someone else, someone sometimes she doesn't know, to other hospitals across the country, sometimes not knowing anything about her child or how her child would come back to her. The medical referral system and the permits that Palestinians need to get their treatment is again part of the occupation, is part of the collective punishments that Israel is applying to the Palestinians. With the ongoing news that we hear about a potential humanitarian pause in the Gaza Strip, I do urge everyone not to use this language because it is manipulative. What Palestinians in the Gaza Strip need at the moment is an immediate, permanent ceasefire. We need to support the healthcare facilities. We need to support those doctors with the needed equipment, with the needed medicines, to ensure that the lives of Palestinians are not taken, to ensure that we can support the Palestinians during this ongoing aggression, during this genocide. Is part of our medical oath to do no harm and to support each other throughout all the dark times. I absolutely urge all healthcare professionals across the globe to be more vocal about the healthcare collapse in the Gaza Strip. It is part of our humanity to support healthcare services, to support those whom are providing those services, to people in need of those services. My salutes to you, my deepest gratitude to those doctors whom are serving their country, whom are serving humanity, whom should be always protected by international law. And I'm not saying anything political here. I'm talking from a humanitarian aspect. We need to support the healthcare system. We need to provide the medical aid and the equipment, the supplies that system needs to keep going, to keep its services running for Palestinians in need.